data analysis, and more from Mayor Dan Pope. And today we welcome Lubbock Cooper ISD Superintendent Keith Bryant for an update from his district and Councilman Steve Massengill. Let's start with Catherine Wells.
Good day, everybody. Thank you for joining us. I'm going to update us on our current COVID-19 cases in Lubbock County, and then also discuss some of the public health strategies that our department is working on as we move into the fall. The health department is reporting 6,975 cases as of yesterday evening. Over the last week, the average number of new cases has been less than 50. This is a great sign for our community as we move into the fall. Nationally, we're also seeing the number of COVID numbers improving, and across the state of Texas as well. There are currently 1,467 active cases, and over 5,000 residents are now recovered from COVID. Last week, the health department reported 7 additional deaths. This brings our total number of deaths attributed to COVID to 94. Our condolences to those families who have lost a loved one to this virus. As we move into the fall, the health department's going to work on the following strategies to reduce the spread of COVID-19 in our community. Our goal is to control the spread of COVID, to keep it at bay so that we can continue with opening businesses, returning to school, and enjoying some of those fall sports. This can be done by following the guidelines set by both the state and national level. The first thing we're going to be working on is supporting our schools and businesses when they have COVID cases. We know that there will be cases, and the goal is to look at these exposures, make sure individuals who are sick are appropriately isolated, and those who have been in close contact with a case are quarantined to reduce the spread in any facility in this town. We also want to encourage flu vaccinations. We really will be facing a twin epidemic when the 2020-2021 influenza season starts. This is going to coincide with either continued or reoccurring circulation of COVID. From late fall to early spring, our hospitals can fill with influenza patients. And if whatever we can do as a community to reduce the severity of influenza or reduce the number of people going to an outpatient facility or those being admitted to hospitals or the ICU will really help alleviate the stress on our healthcare system, as we're also looking at having COVID hospitalizations at the same time. Lastly, the department will continue with contact tracing and investigations. We've been doing this since day one. We've significantly increased the number of staff who are working on contact tracing, and we will continue this into the fall. This process of investigating and notifying individuals who are sick and making sure people stay in quarantine is a key part of controlling the spread of COVID. If we want to continue to reopen, attend schools, and keep businesses open, we all need to follow the same guidelines. The first thing we're going to start talking about now is get that flu shot. The others are wash your hands, make sure you maintain social distancing, reducing the number of people that you're hanging out with, the number of people over at your house. And the last thing is to wear that all-important mask. Dr. Cook is unable to join us today, so I'm going to turn this over to Keith Bryant, the superintendent for Lubbock Cooper ISD. Welcome, Keith.
Thank you, Catherine, and good morning, everyone. It's a pleasure to be with you today. We've had a great start to school in the last week. We began school last Wednesday and have an enrollment today of around 7,250 students, which is an increase of about 400 from this same time last year. And so while the pandemic may be going on, we are still seeing an increasing number of students enrolling in our schools, and we're excited for them to be here. Many of our parents and students and staff, I'm certain, began the year with some anticipation and that brought about some anxiety. You know, fear of the unknown, walking into a school year in the middle of a coronavirus pandemic. I had a lot of people questioning whether it was safe or not to do so, and yet I think a week into it, we've been able to mitigate those fears and those concerns by having such a positive start, as I know the other school districts in Lubbock County have been able to do as well. So we're very pleased with the start we've had. We're grateful to our students, especially, getting kids in school, having them back is such a great opportunity for our community. Number one, it's to educate kids, obviously. Number two, it provides that all-important place for kids to be while parents return to work. And most importantly, it brings some sense of normalcy back into our society that's so much needed today. I will also share that we've had a lot of planning that's gone into this school year. Every other district is the same way, but we partnered with those other school districts in the county, with the city, with Lubbock County, and especially with the Lubbock County Health Department to make sure that all of our protocols are in place, all of our procedures will be followed, and the result has been that we've had a really productive start to the school year. So I want to take a moment to thank everybody, thank Catherine and Dr. Cook and our mayor and our city council and Judge Parrish and all the folks at the county that have worked really, really hard to make sure that we can educate kids as successfully as possible. We have about 85% of our students in class, in-person instruction. The other 15% or so are doing it virtually, and we're glad that parents have that option. We have seen a number of parents indicate their desire for their kids to return to in-person instruction. And in our district, we are allowing that to occur at the end of the first 3 weeks of school, and from then on at the end of each of our 9-week grading periods. And so I think it's positive that we have parents that want to send their kids back that are doing virtual, but we certainly respect those that have chosen virtual and want to make sure that those students are receiving a proper education as well. So at this time, I think I'll turn it over to Mayor Pope. Thank you again for the opportunity to be here today.
Thank you, Keith. We're very fortunate to have your leadership at Lubbock Cooper, along with that of your peers at Lubbock ISD and Friendship. And thanks for joining us today and sharing a little bit about your experience for the first week of school. I want to start today by sharing a little data. So let me share my screen real quick. Okay. So pretty much the same 4 slides or a version of those that you're used to seeing from me. First of all, our positivity rate. This is our 14-day rolling average. Now, there's real good news here. You know that the 6% number is where we want to be or at or below. And although our pandemic long positivity rate is below 6%, what's most important is what our trend is over the last couple of weeks. And this continues to really go in the right direction. This is a good indicator of how much spread is going on in our community. And I think when you see that, as well as our hospital data, which is stabilized and maybe even gotten a little bit better. Remember, we're nearly down to about half of where we were a month ago. We were close to 120 a month ago. We're about 60, mid-60s today. So very, very positive data. Hospitals this is the age, our K-12 students, so ages 6 to 17. You can see that our fully recovered are just under 4 times as many as we have active cases. And then finally, a last 14-day breakdown of case count by age group, a little more granular just because it's something that we get a lot of questions about. So you can see the 18 to 24-year-old bar is the one that sticks out. And that, I don't think that's a surprise to us, but that's where we've had our new cases. There's good and bad news there. We'd like that number to be lower. The good news is it's much lower than it has been at other parts of the summer. Okay. I believe I'm back now. A few other comments. First, I want to echo Catherine's comments about our empathizing with families and businesses that have been impacted by COVID. We've reported more deaths in this last week, and one death is too much or too many, and so our deepest sympathies for those families and those impacted. In the same breath, I want to say thank you to our citizens. We have proven over the last 6 weeks that we can improve upon the spread of this virus. Remember that July 3rd is when the governor's face covering requirement went into effect. We had done it a week before that. His went into effect on July 3rd. So we're now 6-7 weeks from that. We've seen the trend go the right way. It works. Face coverings, our social distancing, making safe and sensible decisions, just implementing good old-fashioned common sense, horse sense, whatever it may be, being responsible. As Catherine said, not hanging out with people you don't hang out with. It works. We know it works, and so we've got to stay the course when it comes to that. Now, we're really pleased now, a week and a half into our K-12 schools reopening. We think there are many more positives than negatives. As Keith said, and what I'm hearing from parents is that their kids want to be back in school in person. That seems to be working well. We've had a few cases, but those plans that are in place have been executed. Remember that sort of the overall planning mantra is expect the unexpected and make sure we make good decisions at that point. And I'm pleased that has happened. The collaboration between all of our education, K-12 and higher education, has been significant. Keith talked about it, and I want to underscore that. I want to spend just a minute and talk about our college kids back in town, and specifically our neighborhoods around Texas Tech and house parties in particular. We share a concern with Texas Tech. In fact, our leadership we're in nearly constant communication. A house party that is outside and often gets over 50 is in violation of both the governor's order and the way we are handling large groups. In fact, any group larger than 10 needs to self-certify, and above 50 needs to run through our Lubbock Safe and would need my approval. We are not only responding to these parties, we're patrolling, and we will enforce the law. It is important that we not throw away the efforts we've made to provide safety in our community over the last 5 months. We've got to do the right thing. We're committed to that. We're committed along with Texas Tech, along with Lubbock Christian, along with our K-12 partners. We're going to stay the course. We've got to be reopened. It's too important to us socially and mentally, and certainly to our education efforts, and finally our businesses. So thank you for what you're doing. I look forward to being with you again next week. I think we're on the right track. I'm very proud of Lubbock. I'd like to now kick it to my peer on the city council, one of the chairpersons of the Lubbock Economic Recovery Task Force, Steve Massengill.
Thank you, Mayor. Good morning, everybody. I'd like to give you an update on our Lubbock Safe businesses, as well as the outdoor events and how we go through that approval process. As you know, the governor's order that we're still under provides for the mayor to approve anything, an outdoor event over 10 people. Currently, we have had 53 events under 50. They are able to self-certify or self-approve. And then we've had 74 events over 50 approved. And I'll have to say that we've gotten in a rhythm with these outdoor events that people understand how to prepare their plans and send them in. We review every plan, and it requires the mayor's authority to approve those plans and those events to be able to conduct themselves. So anybody who's planning an event, remember that over 10, we need to see it. And then we have a way for you to access us at the city website at mylubbock.com/Lubbock Safe. As far as Lubbock Safe goes, we are currently at 972 businesses that have voluntarily self-certified themselves to be Lubbock Safe. The competitor in me would really like to be able to report to you that we're at or over 1,000. So if you're a business that has been thinking about it or have looked at the Lubbock Safe program, I encourage you to go ahead and get that certification completed, because I'd love for us to add 28 so that we could be at 4 digits on that. Again, you can access that at mylubbock.us/Lubbock Safe. You know, our economy, the indicators in our economy show us that West Texas entrepreneurial spirit has responded as expected as we continue to work through the virus. And I think I would echo the mayor's message is we've got to stay the course. We've got to do everything we can to keep our economy open. And I think our businesses have really done a good job. One parting thought would be, think before you click. We have a lot of local businesses that really depend on your patronage to pay rent and put food on the table. And so if there's something you need or something you need to consume and you can get it locally, please buy it locally, purchase it locally before you click and have it shipped in. With that concludes my remarks for the day, and I'll hand it back over to Lacey.
Thank you, Councilman. Now we're going to open it up for media questions. Our media question order today is Fox 34, KMAC, Telemundo, KCBD, KLBK, Latino Lubbock, the Lubbock Avalanche Journal, Texas Tech Public Media, the Daily Toreador, and El Editor. So we'll begin with Brady King with Fox 34.
Good morning, everyone. According to the COVID dashboard, it appears that testing is slowing a little bit. Throughout the pandemic, experts continued to push for more testing. Why do you believe this is happening, and is it any cause for concern?
Yeah, Brady, we've talked about that a bit on our public health calls. When you look at nationally, I think it has slowed. You could argue that it's slowed a little bit locally, but it appears to still be relative. The testing is relatively robust. Part of our challenge is that sometimes we don't get the test results in a regular fashion. In fact, as an example, last weekend we got a data dump from Texas Department of Emergency Management on a number of tests that had been done at Texas Tech. And so it provides for some ups and downs, but testing is readily available. It's free. It's open. It's available 7 days a week, and we want people to get tested. You don't have an excuse. You don't need an excuse to get tested in Lubbock, Texas. Catherine, you want to add to that?
I was just going to reiterate that there's abundance of testing here. We have at least 5 or 6 locations that are totally free for testing. We encourage those that have been exposed, and especially those that are experiencing symptoms, to please come get tested.
Awesome. Okay. And then Mayor Pope, you mentioned house parties and how that's a concern, obviously. You said you guys are patrolling. What is the consequence, I guess, for that? Are they just being shut down, or what's kind of going on there?
Well, I think generally when we get a complaint about a house party, the first thing we're going to try to do is just disperse it and ask people to go home. And we that's not I would imagine that's our normal protocol. I'm not a law enforcement officer, but that's what I've seen happen. If we don't have compliance, or if we have situations where we have underage drinking, then we're gonna take it very seriously. You've seen around the country universities working with college towns to try to nip this in the bud, and Texas Tech and the city and the county have taken too many precautions. We have too much on the line, too many jobs, we don't need businesses being closed down because of bad decisions made by people who in essence wouldn't be impacted by that, but somebody who might be working at that business would be, and they're not able to feed their family. And so we take it seriously. We take the safety of our citizens seriously, and that's no different than it was on March 17th than it is today.
Okay, thank you.
Thank you, Brady. And now we have Matthew Stell with KMAC News.
Thank you so much, Lacey. My first question is for Dr. Bryant. Dr. Bryant, we've got a lot of calls recently about possibly some cases within the Cooper ISD, within the Cooper, within the Cooper School District. My first question is, have there been any confirmed exposures at any of the Cooper ISD schools? And secondly, if there have been, or if there happens to be one, how will that process work as it relates to informing people? Will the entire school be notified like Lubbock ISD is doing? Will those families of students who may have been in contact with somebody who has COVID-19, will only they be informed, their families? How will that process work going forward if there happens to be a case?
Matthew, to answer your first question, yes, we've had 2 campuses since we began school that have had a positive case of COVID among student at each of the 2 campuses. And as per the TEA requirements and our willingness and our desire to be as forthright as we can, we do notify every parent and every family of kids that go to that school, go to that campus, and all the staff members that there's been a positive case. We follow the protocols we have in place, which involves contact tracing and all those different protocols that we have that would enable us to determine if there's anyone at the campus that is at risk, and if so, individual contact is made with that family. But yes, we do notify everyone as required by TEA, and then of course we work with the health department to help mitigate the after effects of that on our campuses.
Okay, Matthew, are you still there? Okay, I think we lost him. So we'll go on to Yahaira Hernandez with Telemundo.
Hello, good morning. So my question is, we've had less than 100 cases every day now, which has been great for our community. However, is this because the county is really lowering in numbers of cases, or is it because people haven't really been doing as many tests as before? Are they not getting tested as before?
Do you want me to take that, Mayor? Or?
Sure.
Okay. As far as we have a lot of availability for testing. I think we do see a true decrease in the number of cases, and that really has to do with the mask mandate that was initiated, like the mayor said, about 6 or 8 weeks ago. So we're definitely seeing the spread of COVID decrease throughout the community. And we really encourage anybody to get tested. That testing is available, and we are seeing people get tested every day.
Thank you. And my second question is, you did mention, Mayor, about Texas Tech. They're initiating their classes this week in person. they are required to wear a mask. I was actually on campus on Monday for their first day of classes, and I saw there was a lot of signs of wearing masks, and there was a lot of students wearing masks. However, a lot of the problem is if they will put the same cautions and follow the protocols when off campus. How do you think this can affect on the numbers we've had recently lowering? And do you think this could affect giving us an increase of numbers?
Well, I think I'll reiterate what I said earlier. Yes, I think it concerns me, and we need everyone to take this seriously, whether they're 6, 19, or 59. We want people to take this seriously. Let's cover our face. Let's keep our distance. Let's follow our hygiene protocol. Let's try to safely and sensibly return to a life that we are starting to realize a little bit more.
Okay, thank you.
Uh-huh.
Okay, now we move to Karen McKay with KCBD. Karen, will you unmute yourself if you're still there?
I'm sorry. Took me a minute there, but I'm here now. Good morning. For months, we've been saying that all the deaths were over age 50. And now it's been a surprise that in the last couple of weeks, we've had one in the 20s and one in the 30s. So can you give us some insight into this and explain, is this unusual? And were these underlying conditions that caused these early deaths?
They are unusual. The majority of COVID deaths across the U.S. have been in older individuals, but that doesn't mean that younger individuals are immune from this disease. I can't give specifics on any underlying conditions of either of these cases, but that does fit the national trend that you do see younger individuals also dying from this.
And Catherine, as long as I have you here, it's interesting that the pending cases, and we talk about tests every night, have varied so much. I mean, sometimes it's over 1,200, and then it'll be very small. Can you explain why that varies so much? Why is that?
Yeah, we get reports of positives all day long within the health department. However, getting the large numbers of number of cases, number of positives and negatives coming from TDM and some of these larger testing sites, sometimes there's a delay. We get the positive very quickly, but getting the exact number of negatives can sometimes take a little bit of time, and that's why you see the fluctuation.
Right. Thank you.
Thank you, Karen. Now we have Terry Furman with KOBK.
Good morning, everybody. My first question is this. I want to go back to Cooper ISD. I want to ask, do we know what 2 campuses there have been confirmed cases at as far as Cooper goes?
Yes, Terry, we had our first case was at Larbush Middle School, and the second case was at South Elementary School.
Wonderful, thank you. Now, my second question is probably for Catherine or the mayor, however y'all want to do this. When we're counting numbers, this has several people confused. We get the numbers from Texas Tech that we look up. We don't know where the numbers specifically are. I'm sure they're going to the city, and we get the city numbers. Is Tech's number separate from the cities, or are all of those being combined together?
Yeah, great question. I've had several people ask me that. I'll start and I'll let Catherine finish if I don't do this exactly right. Texas Tech, just like the school districts, if they're testing, they're all reporting to our health department. The City of Lubbock Health Department covers the city and the county. So the number that we report on a daily basis is a roll-up from the entire community. Texas Tech has their own dashboard. I think they're committed to keeping it updated. They made a little change to it just today. I think they have 87 total active cases as of today, and those would be included in our total active cases. Terry, you didn't ask about testing specifically, but we've had several questions. We've done over 6,400 tests we've reported over 6,400 tests the last week. That's nearly 1,000 tests a day. That may be a little bit below our high water mark, but not far. So we still are doing a robust amount of testing. I know nationally that may not be the case, but in Lubbock, I'm really pleased with that level, and that's because we have testing available. It's because we have good partners at UMC and at Covenant, and with the state, Texas Tech. We're still doing a lot of testing, and so my math says over 6,400 tests reported in the last 7 days.
Okay, Catherine, is there anything you wanted to add to that?
No, the mayor was correct in his description of how the data works. So all test results get reported up to the health department.
Okay.
There might be a 1-day delay between a tech and getting to the health department, but that would be the only difference.
Okay, wonderful. Thank y'all.
Sure.
Thank you, Terry. Now we have Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. Mayor, your numbers don't make sense as far as 1,000 tests a day. Are you talking about tests within the last week or so? I mean, or 2 months or what? Because this has been going on for 5 months now, so I'm a little bit confused on that.
What I said was that we've reported 6,400. There've been 6,400 people tested in the last week that we've gotten data for. What I've done is I've taken total test from starting last Wednesday through total test of yesterday, and I think you'll find that's increased about 6,400.
Okay, I just wanted to clarify that.
Yeah, it's a good question. That's I probably didn't explain it very well.
So, one of the things, and just to follow up with what everybody's talking about, and the numbers being reported and everything, the city has been very transparent about putting out those numbers on a daily basis. Even Texas Tech, the athletic department, they've been wonderful. Where we're finding an issue, and this is where we're getting concerned from a lot of families, is that only the parents get the alerts, which when it was asked or questioned, we were told that it was because of HIPAA regulations, but we did look up HIPAA regulations. As long as the students' names are not being named, I think in some form, I think it would be beneficial for the school districts to share those numbers with media, because in the day of social media, you've got so many rumors happening. So, I know Dr. Bryant is on, but is there a way that, because you are collaborating with the other districts, that y'all can work collectively or share those numbers or those school names with the media so that there aren't a lot of rumors and we can help control that?
I'll start off real quickly that the TEA is going to be having school districts report data by school. And from the health department perspective, I really want to see how that reporting is going to look so that we can get that implemented correctly the first time when it goes out according to those TEA requirements.
That's excellent to know. And Catherine, since you're talking a little bit, I know that there's already people that with the vaccine for COVID-19, there's a number of folks who've decided they're not going to get it because of mistrust, cost, and access. But in lieu of the ups and downs of testing, will you have a better system in place for the vaccine when we get it? I know it's a little bit ahead of the game, but I'm trying to be cautiously optimistic. And is there not a way that flu shots can also be administered when you're doing testing for COVID-19?
It could be. We have plans in place to do mass vaccination clinics. We've done them in the past when we've had flu pandemics or new flu vaccines going out. There's lots of different eligibility and insurance that goes into who's paying for vaccines. The health department's working to secure as much of what we call adult safety net vaccine, which is free vaccine that's provided to us from the CDC that has very little requirements on it. And when that's available, our plan as the health department is to be out there and offering vaccines in as many places as possible.
Thank you. And I do believe our community is doing a great job. I appreciate you guys.
Thanks, Christy.
Thank you, Christy. Now we have Matt Dotre with the Lubbock Avalanche Journal.
Hey everyone, have there been any, so we're all kind of reporting these cases at schools. Have there been any known spread within the classroom, or are these all isolated incidents where a student who had been in the classroom test positive? Have there been any micro closures or known instances of community spread within a school, within a classroom?
Matt, I'll answer from our perspective. Thus far, the answer is no. Both of our cases stem from things at the home environment, not spread from within the campus.
Okay.
And,
are you seeing that elsewhere as well?
And from what of all the cases that I know about right now, I have not seen anything that is spread within the classroom, and that's one of the key things that the health department's looking for. Everything's been someone that's been exposed from outside source.
Okay. And I feel like most of the angst that and it seems like everyone's hearing from parents, the angst we're hearing from parents is that then nobody in the classroom is being told to self-isolate for any period of time. And then, so I guess my question is too much emphasis being put on masks? Because the news release that I'm looking at from Lubbock ISD says the CDC defines COVID-19 close contact as being within 6 feet of an infected person for a duration of 15 minutes while not wearing a mask. So according to that, so long as people in the classroom, no matter, I guess, really how long you had been in the classroom, anyone who's wearing a mask is safe and protected. And I don't think that's I don't think that's what the CDC is saying. So is too much emphasis being put on masks?
Matt, masks are one of the key things that we can do that can be implemented in the classroom to reduce spread. They're not 100% perfect. And there are some discrepancies and caveats between recommendations of CDC, the state, TEA, some of these different organizations. And a lot of them come back to looking at each case is very unique. It's looking at duration, distancing of students, compliance with masking, hand washing. The MMWR came out this last week showing that very good discipline with masking, hand washing, and following those guidelines has really shown to reduce the spread. This study was done in New Jersey with daycare facilities, but it's very similar to what we can implement in our classrooms. The goal is we want to keep kids in the school so that they're learning and really figuring out who those close contacts are and making sure we're isolating the right individuals for the right amount of time.
Absolutely. And of course, if there's been no spread within classrooms, that's the ultimate goal. So that's fantastic. Yeah. Okay, very good. Thank you so much.
Thanks, Matt.
Thanks, Matt. Now we have Texas Tech Public Media with Sarah Self-Walberg.
There we go. Sorry about that. I'm going to go off of Matt's question a little bit. So we now know that deep cleaning is still a good practice, but COVID is more likely to spread through the air than on surfaces, we think. You know, it seems like we know something different about this every day. But so when an exposure is confirmed somewhere and that place is deep cleaned, for example, like what we're doing in our schools, how effective is that? Or do we know yet?
We know from other viruses that deep cleaning is an important part of mitigation. So why wouldn't we clean? We want to make sure that we keep those classrooms as clean as possible, and getting that professional cleaning done is an assurance that, you know, we're trying to mitigate that spread as much as possible.
And not just classrooms. I mean, As I left City Hall Monday night late, we were doing a deep clean on the first floor because we had a council meeting last night, and we were trying to make sure that we provide an environment that's safe for citizens and staff and elected officials. And so it's the right level of caution to take, and whether it's schools or churches have taken this very seriously, places of business. It's just one of the precautions that we think is important to take.
Okay, thank you. And then going back to testing a little bit, I've seen some, we are seeing those test numbers dip a bit statewide. I've seen some explanation that some of that could be because people are doing the rapid test and those are counted differently. Can you explain how and if those are counted in Lubbock, and if that could be contributing to those testing rate numbers?
Sarah, the testing that we're counting as a case in the Lubbock County numbers is somebody with a PCR test, which is the one that gets sent to the laboratory, or the antigen test, which is that rapid test that we see at a lot of our clinics. From a public health perspective, we respond to both of those the same way, and we're counting them both in our case counts.
And all tests are being counted. It's even if you go in for a procedure, you're going to be, and you're tested, we still count that test as still part of our data. We're not, it's all there. We're trying to make sure we show the full picture.
Great, thank y'all.
Thank you, Sarah. Now we have Amanda Hampton with the Daily Toreador.
Hi everyone. So my question is, if there's a significant increase in positive cases, like we've seen in some other college towns, does the city have a plan to address that in collaboration with the colleges here now that college students are officially back?
Yeah, I'll start on this one and then I'll let Mr. Massengill add to it. We whether it's been through our Lubbock Economic Recovery Task Force or ongoing discussions with higher education, we'll continue to put in place the right efforts, the right process to keep our community safe. And I had a chance to talk yesterday with President Skovanec and his CFO COO, and we talked on this very matter. There's another phone call with our law enforcement and their law enforcement later this week. I think we'll probably have a phone call with their student life folks this week. There's a lot of communication going on, sharing of information. It's important to us. Steve, what would you add to that?
I don't know that I can add much. I just think it's important as we know that we have students in town and we know that they're around campus and they're around our businesses, those businesses that are open, is that we know how to control this. And we've done a good job in Lubbock. We need to communicate to them if they're unsure of how to conduct themselves, and we can do this and they can participate in the process. And if we see the positivity rate rise, then we can react to that and work with our universities and our school districts on how to handle that.
Thank you.
Okay, and lastly, we have Olga Aguero with El Editor.
Hello, everybody.
Hello.
I just noticed the mayor off.
Yeah,
okay, Mayor.
he had a prior engagement. If you got a question for the mayor, I'll try to handle it, Olga.
Oh, really, Mr. Massengill? Thank you. Well, the first question, more testing is needed, and I think we all can agree to that. And the more testing we do, the better. So do we foresee more testings availability, or is it availability, or are we just not doing them? Or maybe the people aren't coming. Could you just sort of say a little bit more on that, please?
Well, I'll start and I'll hand it to Catherine. You know, we feel good about the access we have right now to testing. We've worked with TDM and we have sites up where people can walk up. They can test for no cost. And so if for some reason that we don't have that resource, we'll continue to work with our hospitals and prop up as much testing as possible. But from the start of this pandemic, we've done a great job as a community to have available testing. As a matter of fact, when we started, we were testing almost 2-to-1 to the rest of the state. So we will always make that a priority.
And one of the things that we watch at the health department is, whether or not there's available appointments at those testing sites, or if there's lines. You don't need an appointment, especially to go out to the Rogers Park site. But if there's a point where that gets overcrowded, then we'll be looking at expanding. That's open Monday through Friday, so there's nothing that prohibits us from requesting a Saturday or a Sunday testing site also. And if we see those testing sites get filled up, we will work to add additional ones throughout the community.
Good. Well, thank you. That's good to know. And I meant to say, welcome, Lubbock Cooper Superintendent. And hopefully you got more spaces that will be seen on your parking lot. Maybe that'll, what you went through last week, maybe that increased some more spaces to get more involved with different messages. But this was the message for the mayor, and it was, I understand that there's consequences, and I understood his answer and his reply. I just wish sometimes he wouldn't be like jumping around the bush and just sort of being hesitant about you. Sometimes we need to tell that to each other and be blunt with each other, especially here in the community. And I think that would help a lot of the gatherings that do and are happening in Lubbock. And is there a fine? And if there's a fine, how much? I mean, say it down to the nitty gritty. That was what I was going to ask the mayor, Mr. Massengill.
Well, I'll respond to that, Olga. And I don't know the fine, or I don't know what penalties are there, but we want to educate first, and we will respond to all calls, and we will always enforce the law, and we will always make sure that we do that in the sake of public health. And we've been consistent about that since the start of this. And I think the most important takeaway for today is that we are working closely with Texas Tech on any event related to Texas Tech, and they are being extremely proactive to make sure that they are communicating with their students on what the expectations are. So we will continue to do that.
Well, that was all my questions. Thank you. Good information. Good day today.
Thank you.
Thank you.
Thank you, Olga. And that concludes our news conference. Thank you all for joining us, and thank you so much to Mr. Bryant and Councilman Massengill for joining us today. And as always, we thank our regular panelists and our interpreter. For a list of testing sites that are available in the community, we have that on our website, which is mylubbock.us/COVID-19, and it's under the COVID-19 Helpful Resources tab. And that's it. So we'll see you next week. Bye.